Friends, this is Dr. Kabir Sardana from Delhi, and I'm going to talk about an approach to your examinations and, of course, how to practice dermatology and how to learn that particular art of dermatology. And I'm a director professor of dermatology at RML Hospital, Delhi, and I've worked in various institutions, taken exams across universities, including National Board. Now, this talk, of course, is primarily directed against the question that is often asked by PGs to us that how should we study dermatology? Now, the degree that we have still is this: dermatology, venereology, and leprology. I know a lot of us would like it to be this dermatology, cosmetology, and lasers. But believe me, there's no great skill involved in being a cosmetologist. I would request you all not to denigrate yourself and call yourself a cosmetologist because it doesn't require any degree actually. There's nothing great to it. Nevertheless, now dermatology, leprosy, STD. So I'll come with STD first. Now in STD, in my time there was this book called King and Nicole. It was one of the beautiful books of STD where it had a very elegant clinical description, and it still is. And in my time, we used to combine King and Nicole with, of course, Holmes. Now, Holmes is a real thick, fat book. Okay, difficult to digest, difficult to master also. And what I would advise you to do in today's times is something very simple: that you pick up a list of your short, long cases and probably study it from Holmes. Maybe get a photocopy of that particular part and read the clinical features from King and Nicole. Of course, this is one way of going about it. There is definitely another way, which I'll tell you in a minute. Uh, right. So that's about STD. Then you come to leprosy. In my time, Hastings was still a great book. It's still today is a great book. It's one of the finest books for leprosy written. Minus, of course, the fact that it's not been updated. And of course, Jopling was a very small handbook at that time. There's some other books which are really good if you are somebody into leprosy. There's a book by Cochrane, a beautiful book, which gives excellent clinical features, of course, not available in most libraries. Then there are books by Brexon, which again is very small, handy book. And then, of course, we come to dermatology. So this is the amalgamation of three branches: dermatology, leprosy, and STD, that make your degree. In fact, very few branches in medical fields have got three different entities in a degree. In dermatology, of course, you have so many books. You have got Bologna, you've got Fitzpatrick, Rooks, Andrews, and Braun Falco. Some of you read that. Out of these books, remember one fundamental rule: pick up one book, pick up one simple book, and do not go and buy multiple books, because I can assure you, you can't finish these books in 3 years. I would personally advise you to look at Bologna for exams for your degree, and Andrews for an OPD, very good book for seeing OPD cases. Braun Falco is one of my favorites, but most people don't read in the country. Leprosy, I still would recommend Jopling. The edition has been updated now. We have the 7th edition coming up, and it is one of the most updated books, very handy. Of course, you can buy even big fat books if you want, but I don't think it's required. In STDs, most of us do this: combine Holmes, the long short cases, and see the guideline. The guidelines came out just last year, and they're sufficiently good. I would suggest even adding a Nicole to it, and also add syndromic approaches from the NACO guidelines. That would suffice. Now, of course, there is a lot more to dermatology than just this. There is drugs, there is pathology, and there is instruments. Now, in drugs, of course, everybody has a favorite books. I feel that a lot of us read Wolverton. Wolverton, is a book written by a clinical pharmacologist actually, and I've seen Wolverton through the years. Somehow I find it very difficult to read and assimilate and understand. You can read Wolverton, nothing wrong in that. We took out a book on drugs, a very different format, with boxes telling you uses, mechanism actions, diagrams, and indications, and monitoring protocols. So it's your call. I think drug book is mandatory, not just for exam, but also for practice. In histopathology, in my time, we only had levers, and it was a decent small book. But now, of course, we have multiple books. Whedon's was what's read by most pathologists, and most of the pathologists read Whedon for the reporting. Then you have Mackey, and you've got the Anthony Duvire's book. Now, the Anthony Duvire book, the last one, is actually an amazing book because it gives amazing clinical features, beautiful diagrams, photographs, and of course pathology. But for most of us who do not read, these big fat books, I would recommend Mackey uh, uh, over Levers. But of course, I know that most of us would not read so many books. It's your call. But if you ask me for my choice, Mackey is definitely is a very good book to read. Then of course, what else should you read? There are actually nowadays books on every single topic. But some books that you could read. One is Nail Disorders by Sher and Daniel. It's a beautiful book, short, concise, well written, nice font, good photographs, and a very good therapeutic interventions given. You must pick up one of these two books. If both, nothing like it, they are some of the finest books on emergencies which you will face in your MD training, in your first year, second year postings. They're class books. I mean, I know they're books written by people from even our country, but these two books are extraordinarily good. I would suggest pick up one book for bullous disorders. I personally believe this Marcel Johnston's book is a beautiful book, though he has passed away. He passed away with cancer a couple of years back, but even then, this book is beautiful and it still stands its stead. I would strongly recommend that for reading CTD disorders, you pick up a book of rheumatology. It's your call what you want to pick up. This is one of my favorite books by Hochberg. It gives stuff which is beyond what's there in textbooks, concise, beautiful flow charts, and up to date. And mind you, these guys are the guys who have been practicing this particular field for ages. So there's no harm looking into what they do. And of course, pick up a hair group book. This is what I would recommend by Ralph True. But there are many books now, multiple books are there on hair, but this still is a very decent book to read. Then, of course, some of us, have a lot of time to read even more books. So, well, if you have time, yeah, there are many more books. You can have books on various topics out of this list. Some of the books that you probably could look at is probably the book by Hurwitz on pediatric dermatology. It's a new edition has come out. It's pretty good. And another book that I would recommend you to read in this list, of course, if you're interested in that field, is Fisher's contact dermatitis or even the pigmentary system. It's beautiful. It's one of the masterpieces books on the topic. And the rest, of course, it's your interest level. Okay, so there are many books on topics. There are even more books, of various types. So that depends on your interest level. Okay, and how much time you got for medical dermatology. And then there's more, Scopy. There's a book on Brachyscopy. There's a book on dermoscopy. There's a book on dermatophytosis of the IDWell. It's free on the site of the IDWell. And of course, so on and so forth. So there's actually a book on every single chapter of your textbook, okay? Usually by Springer. But I think that, you should know what's there, but it's not necessary to go and read everything. Then come to the point that probably you all would like to know. What are the examination based books? Now, there are very few books in this category and they're varying in focus. And there is a reason for that varying in focus, and I'll tell you why. So there are three types of books in this particular field. The first is books with question and answers. Now, these are useless. I would recommend you never even buy them. You cannot denigrate, an MD degree into a next coaching institute book and a question and answer. This is not the way to learn dermatology. This is your branch, it's your future, it's your career. And mind you, your question, that is the exam, the person who wrote this book, his question is not going to be my question. And his answer will again be not be my answer. Why? Because answers change. So such books are complete waste of money. I know one big pharma company promotes this kind of book. It's total waste. Then you've got books with multiple authors. So there are books with 100 authors and in volumes. Now, my point is if you have to buy a book with volumes, 2 volume book, 3 volume book, why not just read textbooks? It doesn't make sense, reading volume books. Then, of course, you have books which have got case scenarios. Now, again, their point is, I'll tell you why. Because the case scenario books give you tutored questions that you feel the examiner may ask you. And there's another drawback in these case scenario books because they miss out one very important point that half the exam is about how you describe the lesion and how you arrive at a rational diagnosis. This can't be taught by case scenario books. Then you have got books written by certain editors who have never taken a single MD exam in their whole career. And they're editing books written by 100 different authors. Now, there is a difference between compilation and editing. So this, if you want to read a compilation of books of chapters, I think that's pretty pointless. One should at least look at the background of the person writing the book. All of us have been examinees, but not very many are examiners. And how many of us have taken exams across universities? Very few. Then there are books written by certain authors who are prolific writers, but have never guided a single thesis in their life. So, one should look at the background of what you buy. Okay. Then, of course, there are books for US boards, good for US boards, but not for our country. Now, come to the most important part. In examinations, decisions of passing and failing and competence is based on your spotters. And spotters, are a short summary, 5 10 minutes for one case. And it's got 3 steps. The first step is examination and proper history. This is something which you will learn in your career. I would suggest you learn it from your teachers, from your institutes. Don't pick up books to learn what to speak in the exam about history examination. Step 2 is a rational diagnosis or DDs. Again, something that you should learn in your institutes. So I seeing cases and presenting to your faculty. And the last, of course, is the Viva. Now, the Viva can have various dimensions, diagnosis, prognosis, severity, etc., etc. And I think this should be the focus of exam-based books. Now, uh, there's a famous saying: give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. Our focus uh, of the compendium was to make you a fisherman who could, fish or meal instead of giving you, spoon feeding. Spoon feeding is okay till class 12th. Tragically, even now we have spoon feeding in MBBS and then more spoon feeding by coaching institutes. But this is your career, and I would request you to learn dermatology on your own. These books, the compendium series, and now the third edition is going to be out very soon. Our aim was to lay out the best concise knowledge on a topic in a single book, sourced from the best books in the field. The books that I've named in my presentation have all been cited in our book and many more. And I would request you to read and assimilate the knowledge and then answer questions in the exam or even in practice. We don't believe in force feeding, and that's not our aim. And the last and the most important thing, of course, is this book is meant for both theory and practicals. So, with that, of course, I close my talk today, and I thank you all for this talk, for listening to this talk, and I hope it helps you in your life, in your career, and of course, in your exams.